everyone. Welcome to the 5th session of our virtual parent series. Today we will be discussing strategies for supporting students with depression. We're so glad you're able to join us. This work is being funded by the Munroe-Meyer Guild. We thank the Guild very much for making this possible. This series is also being offered in collaboration with the School-Based Mental Health Collaborative, or SBMHC. So the SBMHC is a network of 13 agencies from the Omaha metro area who work together to improve school mental health services. We will be delivering one virtual parent session each month, and we were already to our 5th session today. We will have one more next month where we'll be talking about supporting students with social skills and navigating peer conflict. So here's a look at the series. I'd like to introduce our panelists for today's webinar. Dr. Jennifer Burt is a licensed psychologist and an associate professor in the Department of Psychology at the Munroe-Meyer Institute for Genetics and Rehabilitation. Dr. Burt provides clinical services in an integrated primary care clinic at Children's Physicians Dundee. Her clinical and research interests focus on the integration of behavioral health into primary care, acceptance and commitment therapy, screening in pediatric settings, and violence prevention and trauma. Dr. Burt also has an active interest in prevention and promoting parental knowledge of developmental milestones and positive parenting practices. She is also currently the CDC Children's Mental Health Champion to Nebraska. Dr. Burt serves as a faculty trainer in integrated primary care with the Mid-America Mental Health Technology and Transfer Center. She is the director of the postdoctoral fellowship training program at MMI and serves as a mentor and trainer for junior faculty, interns, and postdoctoral fellows. Dr. Ashley Brazil is a licensed psychologist who has worked with Cherokee Health System since 2019 as a behavioral health consultant. In addition to clinical work, Dr. Brazil provides supervision for practicum students, predoctoral interns, and postdoctoral fellows. She has led the initiative in offering neuropsychology assessments within an integrated care setting at Cherokee Health Systems. Dr. Brazil is currently researching the impact depression and anxiety can have on performance during cognitive tasks. Dr. Brazil completed her PhD at the University of Memphis, where she specialized in pediatric psychology with an emphasis in neuropsychology. Her research interests include neuropsychology, impacts of social determinants of health on access to services, and integrated primary care. So welcome, Drs. Brazil and Burt. We're so glad you're here with us today. I'm going to turn it over to you.
Okay, awesome. We are so excited to be with everyone this afternoon and spend just a little bit of time talking with you about some strategies to help support youth with depression. And I just want to really quickly say that while we're both licensed psychologists, we are also both mothers. And so the information that we are presenting today, we're coming from a psychological perspective, but we're also coming from the perspective of a mom. So I just wanted to say that, these issues come up for children, and, we also are caregivers, and this information is really helpful for us too. So we're going to start with a poll question, and the question is going to be, do you believe your child may have depression? Okay, and there's probably going to be a lot of mixed responses to that question, right? And so one of the things that we hope at the end of the day, you'll have a little bit better understanding about what depression is, recognizing if your specific child or adolescent is struggling with depression, and what are some strategies that may be helpful. Okay, so our agenda today is we want to address some common misconceptions about depression. We want to go over some symptoms of depression and diagnostic criteria. We're going to go over some differential diagnosis. So what are some other things that could be going on that oftentimes the symptoms look like depression. We're going to discuss potential impact depression can have on school functioning. Some really exciting things about evidence-based treatment options and tips for caregivers to help support youth who may be struggling with depression. I love these pictures because Dr. Burt is all the way in Omaha, Nebraska, which is just such a beautiful city. And then I like to show off Knoxville's skyline when I can because it's really beautiful here. Okay. So we're going to go into some common misconceptions about depression, and we won't do polls here, but we will really just, I want you to think through for yourself. So I'm going to pause after I read each statement. And I want you to think if this thoughts ever come up for you. The thought of it's just a phase. Everyone can be sad. It's normal to be sad. Has that thought ever come up for you? We know that sadness is normal. It's part of life. We're going to experience sadness. Our goal is not really to pathologize. Sorry, it's hard to speak this afternoon. Normal feelings, but untreated depression can last for months and years, and we're going to talk more about that. They have everything. They are smart and have friends and supportive parents. How can they be depressed? I want you to just think through, has that thought ever come up for you? You know, I'd say a lot of people may have had that thought. Depression is biologically based. It's a biologically based illness, but it can be triggered by environmental stressors. And we're going to go into more detail again throughout this presentation. The next one is all teens are irritable and have an attitude. It can't be depression. You know, adolescence is a time period where youth are trying to assert their autonomy and independence. And that can lead to increased conflict with parents, right, or others. It's important to pay attention to other signs and symptoms to determine if that irritability is more normal or it may be more indicative of depression. And again, hopefully by the end of this presentation, you'll have a better idea of what that is, what's normal and what seems to be more clinically significant. So just a few more, just the thought of she's just lazy. If she would only try harder. This thought often I feel like comes up for parents at times when we're having a hard time getting children and adolescents engaged. Depression can affect a lot of different areas: sleep, energy level, motivation. It's important to note that teens can't just mind over matter themselves to do things. And we're going to talk about more strategies later in this presentation. Dr. Burt specifically is going to talk about strategies to help engage youth and help. The next one is, I believe, asking my child about thoughts of self-harm may put the thought in their mind or make it worse. And again, research just doesn't support this. And again, I don't want to, spoil alert for later, but we'll address this more too. And then the next one is, I believe medicine is the best way to treat depression. Research has shown that engaging in evidence-based therapies are extremely effective. Some medicines can be helpful, but generally the recommendation is to engage in therapy in addition to medication if your family wants to go that route. And again, Dr. Burt's going to go more into detail with that. So let's get into symptoms of depression and diagnostic criteria. When we think about key symptoms of depression, I have a list on the slide, so you're definitely able to read this. I'm going to go through it a little bit just to talk about specific, details about the symptoms. But we have sadness, and that's one that I think a lot of people typically pull out. And when we think about sadness, we're talking about a depressed mood, low mood, most of the day, every day. Teens might often, or children might often use the phrase of I'm sad. You may notice just some nonverbal. They're more tearful than usual. They may have a different posture. They're not making eye contact as much. Anhedonia, that is a fancy way of saying lack of motivation. So this is, I think, the symptom that often gets confused and portrayed as lazy, but really it is a loss of interest in almost all or all of activities. They may lose interest in their favorite sport, extra activities outside of the house, after school, interacting with friends or family members. Appetite disturbance is also a key symptom that we typically look at. We can see an increase in appetite. We can also see appetite suppressant, so a decrease. It's generally concerned when there's a 5% weight loss and they're displaying other symptoms on this checklist. If you have concerns about weight loss or eating, then I really encourage, reaching out to your primary care provider and letting them know about those concerns. Insomnia and hypersomnia. Insomnia is just the lack of sleep, so difficulty falling asleep, not getting as much sleep. Hypersomnia is increased. Fatigue, that's not uncommon. Look out for comments of I feel tired all the time. I do want to make a comment with sleep and fatigue. It's really important to consider both behavioral things that could be contributing to those outside of just struggling with depression, such as like poor sleep hygiene, on electronics, tablets, phones, lighting in the room, all of those can significantly impact sleep. And I'll say a lot of times when I'm working with families and teens and children who are having sleep problems, a lot of times there's an issue in one of those areas or a change that we can make and sleep will improve. But we also want to consider medical. Does the child have sleep apnea? Are they tired all the time because their iron levels are low? So I think it's just really important when you do have sleep concerns, make sure to bring that up to your primary care provider also. Feelings of worthlessness and inappropriate self-guilt comes up. Concentration difficulties are a big one that we see with children and youth with depression, irritability, and then again, those suicidal thoughts. I think the big thing is just knowing that it's not just one of these symptoms that mean your child or your youth has depression, but it's a combination. So the criteria that we're looking for when we're making a diagnosis is how many of these symptoms are they experiencing, how long, and the biggest thing is what kind of impact is this having on the person's daily functioning, because everybody can have some of these symptoms at one point or another. We're going to make sure that those symptoms are not related to another medical condition also. So symptoms can vary by age. And so I made just a table here for you to look at. For children, along with feelings of sadness and hopelessness, you can have problems at school. You might see more of that loss of interest, changed eating habits. Some additional clinginess or anxiety might come up. Some more conflict or difficulty with family members. You might see an interest or a push to avoid school or other social activities that can come up quite often. With teens, we can see some of the same things that we see with children. In addition, there's an added pressure to fit in, succeed. There's a lot of hormonal changes that are going on in identity development that adds a layer of complexity with teens. You might see even higher levels of irritability. I think it's important just to note that there's a lot of factors that can trigger depression. Adverse child experiences are one of those things. So experiencing significant family disruptions, experiencing abuse, learning problems, major transitions, things like that, loss of family members or pets, experiencing community violence, racial or ethnic discrimination. I mean, there's a lot of different factors, adverse experiences that can go into some of these symptoms too, and the severity. So when we think about differential diagnosis, and I'm going to be mindful of time, I'm not going to spend a significant amount of time going through each symptom like I just did, but I want you to be aware that depression can oftentimes be comorbid or go along with other diagnoses, but it could also be something else. There's a lot of times an overlap in symptoms. For example, anxiety. I don't think it's a good presentation if we don't have a Venn diagram, so I had to throw one in there. But if you look on the left of the screen, depression, I've already went through these symptoms, key symptoms. Anxiety and has a few of its own unique symptoms, but there's a high overlap between depression and anxiety. Just to touch base for us, just a minute on some of the symptoms that you see with anxiety that may not go with depression is avoidance behaviors. So again, trying to avoid the stressor or the trigger to the anxiety. So a lot of times we see that with school refusal or wanting to avoid areas with large groups. We see obsessions and compulsions can go with anxiety. Doesn't mean they have to have those, but they can. And an obsession is just a persistent and unwanted thought, image, or urge that enters the mind and triggers distress. So fear of contamination, fear of dirt, fear of harm are some of the examples. Compulsions are just recurrent behavior or mental acts carried out to provide the relief brought on by the distress of the obsession. So a lot of times, some examples could be like cleaning repetitively, washing your hands over and over again, checking the stove, windows, doors. It can be mental rituals. So I'm going through the same thought process over and over again, repeating words, things like that. Somatic complaints is just like those physical complaints, like I feel nauseous, I've got a headache, I've got a stomach ache, restlessness, muscle tension, and anxiety and panic attacks. This is a chart from the CDC. These statistics are from the years 2016 to 2019. Now, I will mention that these are pre-COVID numbers. What we know based on mental health with youth in its current state, these numbers are higher. This is an underestimation of what really the prevalence rate is. But you can see depression, anxiety, some behavioral disorders. Parks and colleagues completed a study in 2015 of over 7,000 high school students between the ages 14 and 18, and they did this in Colorado. They found that youth with multiple and marginalized identities were at higher risk. So we know that that's a higher risk factor. So specifically youth with who identified as bi or multiracial or Latino, as transgender and non-binary, they all had significantly higher levels of depression. So that means more symptoms, longer duration, and a higher chance of experiencing suicidal ideation compared to cisgender white high school students. And then, of course, we know from research that children with developmental disabilities, including autism disorders, are at increased risk for depression and self-harming behaviors. Some studies have found that delayed diagnosis of autism are associated with increased risk of symptoms also. Depression and bipolar, I wanted to really put this slide in here, and I really am not going to spend a lot of time here, but I think this comes up so often. I hear from a lot of parents, I think my child has bipolar. And when I ask what makes you think that, what's brought that thought on? And it's like, man, their mood just fluctuates. 1 second they're happy, and a minute or a couple minutes later, they're frustrated, they're mad, they're angry. And so I really want to just educate that you can experience daily mood fluctuations from high to low with depression. That is not uncommon. And that's because you do have those feelings of sadness. You do have those feelings of, that symptom of irritability. That does not mean that somebody who is depressed cannot have happy moments, right? It says they're experiencing these symptoms a majority of the day. So you can have daily fluctuations. There's a high overlap between symptoms between these two disorders, but the big difference is with bipolar, the child, the youth have had to experience a manic or hypomanic episode with irritable or elevated mood. So what is that? A manic episode has to be 7 or more days of the symptoms I'm about to go through, and a hypomanic has to be 4 more days. So they have to have 3 or more of the following. So a lot of times during those, they may have like a grandiose view of themselves, high inflated self-esteem, I'm unstoppable, like I'm the best person in the world, decreased need for sleep. So they don't feel like they need much sleep, but they have a lot of energy. You might see increased talking, fast-paced talking, racing thoughts, getting distracted easily, an increase in goal-directed activity, or starting a lot of activities and then stopping, not being able to finish because there's that concentration difficulty. And then there's engagement in high-risk behavior. So it could be as much as like, I'm going to go to the store and steal something, or I'm going to buy this really expensive thing with my parents' credit card, or I'm going to engage in high-risk sexual behavior, so unsafe sex. I mean, there's just a lot of different high-risk behavior examples, but those are just a few. So that's the big difference between bipolar and depression. If you have not, or if your youth has not experienced those manic or hypomanic symptoms for that duration, they wouldn't meet criteria for bipolar. There's something else going on. And I will say that, there have been additional diagnoses that, have been created to help account for that increase in like temper outbursts. So there's disruptive mood dysregulation disorder that really, for children and youth who present with that like temper outburst, they're quickly set off. They may be meeting criteria for that versus bipolar 2. So there's a lot of, and hopefully you see, there's a lot of thought that goes into making these diagnoses. There's a lot of things that have to be met before a diagnosis can be made. Depression and trauma, there's definitely some differences in symptoms and some overlap. For trauma, a lot of times you see that's that direct exposure, witnessing trauma, learning about it. So it can be direct or indirect exposure. You see a lot of intrusion, so flashbacks of whatever the traumatic experience was, upsetting memories, nightmares. We see some avoidance there. You may see some negative alterations in cognition and mood and in arousal and reactivity. So that's maybe negative thoughts or feelings that begin to worsen after trauma. So an example would be the inability to recall key features of it, overly negative assumptions about yourself or the world. It can be irritability, especially with those alterations in arousal and reactivity. It can be aggression, some temper outbursts, hypervigilance, so being extra alert, on guard about your surroundings. And then there can be some dissociation, which we won't go into a lot of details about that today. Depression and impact on school function. We know it can significantly impact a child and youth's experience about school. It can impact so many different areas. And so I want to just take a moment to touch base on those. So, we know that depression, a key symptom that we often see is that anhedonia. So that lack of interest in doing activities, that withdrawal, right, and isolation. And we know that when we're struggling with those things, that it's going to impact peer relationships, social connections, right? So a lot of times kids and youth will feel more withdrawn, feel more isolated. They may pull themselves back from interacting with friends. They're sitting by themselves in the cafeteria. They're skipping lunch. When there's free time in class, they are putting their head down on their desk. They're not talking to anyone. I mean, they're just really pulling back. When we think about cognition and depression, we know that depression significantly impacts key areas of the brain responsible for sustained attention and focus. So really big thing is concentration difficulties. And a lot of teens and children will report problems with memory when they're experiencing a depressive episode. They're like, man, I can't remember things. I have a really hard time. And a reason for that is because the symptom of difficulty concentrating causes a secondary impact on memory. So what I mean with that is, if I'm distracted and I'm not able to pay attention and attend to the information that's being presented, then I'm not going to be able to encode it to my memory. So it's not necessarily a retrieval issue at that point. It's that I never really was able to take the memory in, right? We also know that one of the key areas that's activated in your brain when you're experiencing a depressive episode or low mood is your right prefrontal cortex. And so when that area of the brain is activated, it makes it where the left side, so that left prefrontal cortex is less activated. Okay. And that's really important when we think about school performance, because we see less activation in the area of the brain that's responsible for executive functioning, which is our planning, our working memory, our sequencing, our organization, cognitive flexibility, being able to shift, monitoring. So that's what that left prefrontal cortex is really important for. It's the house of those executive functions. And so when we see low mood, and there's MRI studies to support this, when we see low mood, when someone's experiencing a depressive episode, that area of the brain is less active because the other side is more active. And that's just how the brain works. And, when we are experiencing low mood or depression, it can affect where our spatial attention is shifted, right? And so typically, I won't go into too much detail, but when we're experiencing a depressive episode or we're noticing low mood, the area of our brain that really shifts our attention downward and not looking upright is more activated. And we know that when social interactions are suffering, when we're having difficulty connecting with peers, that can impact school performance. But we also, just what we talked about, like the impact on concentration, the impact on memory, spatial attention, those can all impact school performances. And so you may see that grades start to suffer. And so what can we do to help support our youth in the school? Because that's a really important thing, because we know that it can impact that. One of the ways is advocating for a 504 plan. This is a Rehabilitation Act, and it's a civil rights law. It's covered under Section 504. It's not part of special education, so it's really a tool that's aimed to provide students with equal access in schools. It's a formal plan that discusses how schools will support students to remove or limit barriers to learning. And I'm going to talk about what are some common accommodations that you might request in this, knowing the information we just talked about. I will say it is important to note that schools do not have to create 504 plans. There's no set rules, but a lot of schools, especially public schools, are really willing to work with families because they want the kids to succeed too. So how do you advocate for a 504 plan? Make sure you gather documentation, reach out to your school's 504 coordinator. You might be like, I didn't even know our school had one of those. Reach out to the guidance counselor and ask who that would be. You can write a formal request and prepare for an evaluation process. I think arranging meetings with schools. The biggest thing between an IEP and special education, and you're going to have these slides, and a 504 plan is meant to provide accommodations to help the student in the classroom that they're in. They're usually small changes that help them follow along with the general curriculum. Whereas an IEP is more specialized instruction or services. They may work with learning specialists in or outside of the classroom. So these are some accommodations that can be used for students or youth who may be struggling with depression. I think a big one is just increased flexibility because of that lack of motivation being a key symptom. Allowing extra time for homework or tests may be really important. Preferential seating, since we know that there are concentration difficulties, we're more likely to get distracted, sitting up front, closer to where the action's happening may be helpful, or where they're not as distracted by peers. Finding the good, providing positive reinforcement. So really reinforcing what you're doing. Oh man, good job. I'm so proud of you for completing this page, this one page of our 5 pages of homework, reinforcing what they're doing. Not like, oh man, you still have 4 pages. You've only got 1 page done. That's our natural instinct. You've been working on this for an hour, but instead, like, I'm really proud of you. You completed a whole page of this. Good job. Assistance with note taking, I think, is a big one. And schools can do this in different ways, and you can advocate in different ways, but providing a printed copy, just because there is difficulty, like we said, with that attention, that executive function, taking notes when you're experiencing a depressive episode could be, it takes the cognitive load is just so heavy. And we already have low motivation. So a lot of times just notes are not going to be taken all together. Another thing is asking for peer support. So can they borrow a peer's copy of the notes and copy them later? Frequent check-ins, I think, from staff is really important. Asking the student if they need any additional support. How's their day going? Just by one adult in the school checking in with students, we can see big improvements, right? And just in the feeling of being supported. Validating and encouraging, recognizing like, hey, this is really hard for you right now. I know it's extremely hard for you to get up and go to school, but you're doing it and I'm so proud of you. And I recognize that this is hard. And hey, some days I don't want to go to work. It's really hard for me to get up and go to work. I think it's good for youth to know that. And so that's where that validation piece comes in, and just encourage, like, I know you're doing everything you can right now, and I'm really proud of you. I think with another one that I don't have on the slide, but it's just time management and organization. That can be really difficult, right? Like we talked about. And so chunking things into what is most important, right? So what's the most important thing in this assignment that needs to get done? Or, we're going to do 10 problems and then I'm going to let you take a break. So chunking that work and prioritizing what's the most important. Some schools will work on reduced work plans and more flexible makeup plans, I think, is really important, because a lot of times you get behind on assignments. So working with teachers and educators to increase flexibility with that. Okay, I'm going to turn it over to Dr. Burt.
Thank you. That was fabulous. And I love the theme of focusing on resiliency at the end and building that resiliency in school. And we're going to continue that as we talk about what you can do at home as a parent. And depression is bleak. It gets really hard to talk about. It's very overwhelming. And we're talking about tips here today, whether your child really meets criteria for depression or just tips to help build positive mood and catch those pitfalls before they get too big and too overwhelming. And while we're going to have to talk about some heavy things, we are going to really focus on what you can do. And like Ashley said, we're going to start small. We're going to be positive about what you can do, and we're going to build on that. And so one of the things I'd like you to think about, and we're going to pause and think about at this point, is something, it's a tool that we use as therapists with kids a lot. And I thought this would be helpful for you to see as a parent, is just putting your mood on a 1 to 10 scale. You often just hear about the extremes with teenagers at times, and our mood does, as Ashley said, it fluctuates through the day. We see highs and we see lows during the day. So when kids come in and work with us, we'll often say, hey, give me a rating of where your mood has been in the last, week or two since I've seen you. And we put it on a 1 to 10 scale, with 1 being the lowest your mood could be. This is when you're having intensive suicidal ideation with like a plan and intent. Or a 10 being best day ever things. We're not 10s all the times. That's a problem. That's that manic behavior. If you're always at a 10 is like going to your favorite concert, a holiday, special occasions, winning some type of competition. And 5s are just meh. Like, I'm fine, I'm average, I'm not great, I'm not bad. When we start getting below 5s and we're staying below 5s, that's when we're talking about depressive symptoms. In that 6-7 range is often a pretty healthy range for kids to be, but during the day, you might see it fluctuating. And so one of the things I want you to do is pause and think of, where's my mood been in the last 2 weeks? Because your mood can have an impact on how you interact with your kids. And then take a moment and pause and think about, where's my kid's mood been? If I had to guess, and it is a guess, it's an internal thing, where do I think they've been in the last 2 weeks? And then just hold that in your mind as we continue to talk in this next session, and really look for what are the kind of tools that I want to use as a parent with my child, and how do I know we're at the point that we might need some more professional help to get to where we want them to be. So we're going to transition. First, I want to introduce you to evidence-based treatments. And when I say evidence-based, that means in research where they've studied hundreds or thousands of people. And in this case, we're talking about kids, evidence-based research for young people, that most of them responded in a favorable way to this. More often than not, they responded favorably. While I'm talking about this, I do want to keep in mind that some kids and young people may respond well to a treatment that isn't evidence-based, but when you put your energy into things, and I say your time, your resources, your money, it's always best to start with what there's an evidence base for, and then think about what's the best fit for my child and my family. We have 2 evidence-based treatment, well, 3, but 2 that are therapy-based for kids and families. And then we have a few that are very promising. We have really good data for adults, and we're getting good data for kids. And I'm going to give you just a brief introduction to those. So one is CBT, and this is really the gold star for adults and young people. CBT basically means, it's cognitive behavioral therapy, is that thoughts influence our behaviors and our feelings and vice versa. And it targets patients' thoughts and behaviors to improve their mood. So essential components of it are things like doing things you enjoy, those are behaviors, trying to reduce negative thoughts and identify more helpful or true thoughts, and then learning some skills like being assertive and problem solving to reduce those feelings of hopelessness and being overwhelmed. Very importantly, it's an active approach, and all these evidence-based treatments are active. Your child should expect to do homework, and I put it in quotes because it's not often a lot of writing like school, but they're things that your child does and you do to help build better tools for them, so they don't need therapy forever, so that they know how to live the life that they want to and have the tools to challenge negative thoughts and challenge overwhelming emotions. The next one is IPT therapy, interpersonal therapy, and this is really relationship focused. It really focuses on our interpersonal or relationship problems can increase the likelihood of depression, but then depression, the symptoms Ashley went over, really can exacerbate those relationship problems. And so it targets their relationship problems to help improve their relationships and their mood. And it really is, what are the places in my life that I'm struggling in relationships? How can I gain some problem solving skills to make those better? And how do I change how I communicate and strengthen the way I communicate so my relationships get better and my mood gets better? These two promising therapies I truly do love, and I find a lot of value in doing them with young people and adults, and they're helpful for parents as you're working with your teens. DBT, dialectical behavioral therapy, all of these are also focus their roots in CBT. So you're really focusing on understanding how to accept and know your difficult feelings. You learn skills to manage them, and that's the mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. And then you use those skills to make positive changes in your life. You focus on some acceptance strategies, that this is a normal part of life to have hardships. And you also focused on, you can hold two things at the same time. You can both know that you need to make changes in your life and accept yourself at the same time. And you work on doing that. It's a little different from CBT because of that acceptance level. Instead of trying to change everything, you accept it and then do more helpful behaviors and actions. The other thing that's different is this is for pretty severe to moderate depression. It's a very intensive treatment. Oftentimes it's group-based, so you do the skills in a group, and then you have your own individual therapist that you meet with and apply those skills. And so we use this for more severe depression, very intense emotions, although it can be helpful for other people as well. And then acceptance and commitment therapy, or ACT, which is kind of part of how Dr. Chadwell and Dr. Brazil and I got to know each other. We're kind of ACTies, we like ACT. And ACT is, again, a CBT therapy. But again, instead of focusing on how to change those thoughts and they're maladaptive and we have to change them, we're focusing on accepting that our thoughts and feelings just are, they're normal, and they don't necessarily define us or who we want to be. And so we learn how to recognize them, accept them. We use these 6 skills on here in the Hexaflex to be able to move forward in value-directed action. So even if we're having tough situations, painful emotions, unhelpful, untrue thoughts, we can choose to take action in the things that we want to do and the things we want to be in a very gradual way. And so these are both really promising, helpful therapies when you're looking for things for your child that might fit for them and your family. The other promising, and not promising, very research focused and based is medication. Young people with mild depression are usually treated better with psychotherapy alone, using one of those evidence-based therapies. But if the symptoms don't improve or they get worse while they're in therapy, after 6 to 8 weeks or so, you're not better, but you're trending in a positive direction, then we might recommend adding medication. SSRIs are the most effective drugs currently used to treat kids and adolescents with major depressive disorder. And that's major depressive disorder, not sadness. We're talking moderate to severe depression. There's only 2 that are recommended for kids by the FDA. That means that the FDA has approved them, and that's Prozac and Zoloft. There are other medications that can be used if your child is treatment resistant, but we typically start with using one of the SSRIs first. And if they're treatment resistant, then a psychiatrist would probably get involved instead of a primary care physician to help find another medication that might work. We also know that medication is more effective with adults than it is for teenagers. And so adding that therapy piece is often very important in order to have the best outcomes in treatment. When we talk about medication, we have to talk about side effects. Most people don't experience any side effects. And so that's a positive thing. And the ones that do usually experience one of the very common ones I have listed on there. And they're usually only short-term while they get used to the medication. Physicians will start them on a very low dosage to minimize side effects, and they'll only move up in the dosage if they need to. If you have a child that's already has medical concerns or other mental health concerns or an intellectual or developmental disability, often we recommend that you work with a developmental pediatrician or a psychiatrist on medication, because when you're adding different psychotropic medications, you want to work with an expert. If your child is neurotypical or doesn't have any other medications or health concerns, you can often work with your primary care physician if they're comfortable with this. It's important to know that it takes a couple weeks to even know if this is helping. This is a buildup medication. It's also important to know that most kids don't have any improvement for at least 6 to 8 weeks, and then you often have to increase the dosage of that medication. You don't stop taking the medicine as soon as you feel better. You have to work with your physician to gradually wean off of it. And the evidence tends to point to 12 to 18 months after your symptoms, your depressive symptoms are no longer interfering. You stay on that medication to reduce relapse and having another cycle of depression. You see on here, the black box warning is our specific to adolescent side effect that is serious and dangerous. And it's very, very rare that it happens that a child taking medication for depression has an increase in suicidal ideation, but it does happen. And so that's why we really recommend if you're doing medication, you need frequent follow-up with your physician. You have a way for checking on your child's mood, and therapy is often really important in that stage. It gets scary as a parent. I'm a parent of teenagers. I understand this. It's your worst fear in the world. And so it's also important to know that not treating depression puts your child at significant risk for suicide. And so just using these evidence-based approaches is an important piece. And so we're going to transition into understanding a little bit more about suicide, but then we're really going to focus on what do you do to help build resiliency and protective factors as a family, whether your child is showing depressive symptoms or not. Generally, risk factors fall into 3 categories. Some of these are going to be modifiable. You can change them. There's things that you can do to reduce this risk. And some of these, they just are. There are things you've experienced or they're health concerns your child has experienced. I want you to focus on what you can change. And what you can't change, we're able to build more protective factors, and then it can negate some of those. So your health, your environment, and historical things that have happened to you. So that might be adverse childhood experiences. It might be a lot of stressors in your family or abuse or neglect. And those kind of things that have happened historically do put you at greater risk, but they don't necessarily mean your child's going to have suicidal ideation or want to attempt a suicide. I want to emphasize that any comments about suicide should be taken seriously. Even if it's a cry for attention, it's still important to take it seriously, because a cry for attention is where can we build some protective factors here? And so before we start going into what to look out for suicide, I want you to pay attention to these. Having access to healthcare and mental health care is a huge protective factor. Having experts on your team to help support you and your child and your family. Building your family connections, one of the most important protective factors. Having somebody in your life, an adult that you can trust and go to and care for, greatly increases the likelihood of better outcomes for your child. Helping your child to learn how to cope with adversity, how to problem solve, those are really important skills, whether you're depressed or not, and they can protect you from depression in the future. If you learn to understand that we all have adversity, what can I do? What are my ways? And what are my resources to get through this? A strong peer support system, our research tells us you need at least one really good, solid friend. It's great when you have more. It's great when your child is really well connected, but trying to find at least one person, whether it's in the school or outside of the school, that's your child's person outside of you, is important. And then getting involved. Schools do a great job of having music and sports activities. Some of the schools are doing a much better job of having different kinds of hobbies and activities and clubs. I see that pick up a lot when you get into middle school and high school. Find ways for them to get involved in their school, or if there's not things they're into at school, find them in the community or do them as a family. And then tap into your religious and cultural practices. Those are huge protective factors. It's a way you bond as a family. It's a way you connect as a family. And it's also a way to connect to other people outside your family that can be that source of support for your child. And then this one's really important. If you have access to lethal means, this can be medication, sharp objects, firearms. you need to limit those when your child is having depressive symptoms. Finding a way to get them out of the house or out of the houses of people that they spend a lot of time with is an important way for protecting them. And this is where you can connect with your school counselor or your primary care physician. They can work with you on safety planning for your child, but they can also often give you like a locked box if you don't have those kind of things at home to get them out of the house and take them somewhere else. These are your warning signs. Again, we're going to come to 3 categories. What are they saying? What kind of words are they using? Are they showing hopelessness, not wanting to live, feeling like they're always letting you down, even saying, I want to end my life or kill myself? What are their behaviors? Do we see increased risk-taking behaviors or withdrawal or isolation, sleeping way too much or too little, starting to say goodbye, or giving things away, or extreme fatigue or aggression, lack of motivation? And then finally, mood, depressive symptoms, anxiety, an incident that led to a lot of humiliation or shame, a lot of anger. And then this one, a sudden relief or improvement in symptoms. That is something to pay attention to as well. Sometimes when youth make the decision that they want to end their life, there is a little bit more energy and relief of symptoms. And so that is a time to pay some close attention to. What should I do if I'm worried about suicidal ideation? Dr. Brazil hit on this a little bit. There is zero research or evidence that if you talk to your child about it, it's going to plant the idea in their head. And most of our research points to kids giving clues and talking to people about some of those signs that I just put on there in the weeks ahead, that rarely does it just completely come out of the blue. So if you have a concern, ask and be direct and use the right language for your youth's developmental level, whether they're functioning, at a 7th or 8th grade level or higher or lower than that. Use the language that you can connect with your child. And a lot of times it's pretty simple and it should be direct. It sounds like you're dealing with a lot. Does it ever get so tough that you think of ending your life? Be specific, and then lean in and be curious and listen. I encourage parents to listen and ask reflective questions before you jump in and try to fix it or understand the why. Right now, the why isn't always the most important. It's the what and what do we do next? And the why can come down the road. Can you say more about that? I'm sorry you're feeling this way. I want to understand more. Share some more with me about why you're feeling this way. And then complete being on their team. I'm here no matter what. There's never a problem too big we can't solve together. We're gonna find the help that you need to feel better. I'm on your side here. And then get professional help. These are situations where you need experts to help you in your school, in your medical community, in the mental health community. And be aware if it's life-threatening, they have a plan and intent and they want to do it, you need to call 911 or go to the hospital. If they're showing signs and you don't have access to those resources right away, call 988. It's a crisis support line. They will walk you through and talk you through your next step as a parent. And it's also a great resource for your teens. Okay, so now let's get to the point you've been waiting for. We've got 8 tips of things that you can do. I'm probably not going to go into them in a ton of detail, and I'm going to talk about them kind of broadly, but there are more details on all these slides of how you can use this as a family. Number 1, encourage social connections. Based on what you've learned about depression already, you know that depression causes you to withdraw and do less of what you used to do. And oftentimes that's connecting with other people, and humans are social beings. Whether you're introverted or extroverted, we need connections. So COVID really didn't help any of us with that. And I think some kids, especially looking at your kids being in that middle school or high school age at a real formative time in their life a couple years ago, when your social connections become a priority, they had to be isolated from a lot of people they cared about and loved, and maybe it developed some habits out of that. So find ways to connect as a family if that's where you start. and then try to find ways to connect with them in the community, whether that's getting involved in something or doing community service or helping a neighbor or a grandparent. Just get them connecting again and make FaceTime a priority. This one's going to be tricky. And we'll talk about it in the next one. You don't have to go back, Ashley. Reduce social media time. We're going to talk about that as we go. That tends to be how they feel like they're connecting with others, and it can be huge and a gift, and then it can be really unhelpful. And so we're going to be thinking about that as we go on how some social media time is good. Too much can lead to depressive symptoms. Encourage participation in activities. Psychologists have found that there's a super close relationship between our activity and our mood. When we feel good, we usually spend more time with people that we enjoy. We do things that we enjoy. We're willing to take on challenges, especially if we have better memory and attention, right? We can do things that are challenging, where we feel successful, where we have some positive feedback and mastery. And when we do that, our mood improves. On the other side of that, people who are depressed tend to do less, tend to connect less with others, tend to feel, have more problems with some of that attention and memory. And then it's trickier to feel like you're successful and mastering things. And that can lead to withdrawing from others and connecting less. And so this diagram kind of shows that vicious loop you can get into, but it also shows how you get out of it. And this is called behavioral activation. And it's usually one of the first places your therapist that's using an evidence-based treatment is going to start, whether you're a kid or an adult. In behavioral activation, instead of using your mood to direct your behavior, you're really going to focus on setting some goals of what you want to do and chunking them into really attainable and meaningful steps. Using values works best. So at the heart of it, we don't use how we feel, like, oh, I'll exercise more when my mood improves, or I'll eat better when my mood improves, or I'll start doing my homework when I feel better. Instead, we figure out how to do some of those things. And when you start doing more of them, your mood starts improving. So if we break this into steps, this is the kind of thing a therapist would do and go into great detail. I'm going to give you kind of a Cliff's Note version of it right now. But as a parent, it could be just setting one goal each day with your child of something that they care about, that's meaningful, that they want to do. It starts with providing education that it's normal to have highs and lows with your mood. Sometimes you get stuck in the rut. It makes you not want to do things and be motivated. And that's a normal thing that can happen. And your way out of it is to start doing the things you care about again. So where can we start? You can start with helping them monitor their activities or monitor their mood on that 1 to 10 scale. We'll talk about some apps you can use later. Help them identify what they do that makes them happy, what they do that gives them joy or brings them energy or makes them feel successful. And then set a goal and make a schedule and figure out what's going to get in the way with that and help them plan and problem solve how to do that. And it's okay to use reinforcement for that. We all do better if we have people praising us, or if we kind of integrate some self-reward into their day. So for example, if your child is, not spending time with other people and not hanging out with their friends anymore, it might be way too hard to call a friend, ask a friend to hang out and do something with them. That is a lot of steps and it might be too hard. But maybe we start with just talking to somebody at school, or texting a friend, or spending a little more time outside the bedroom connecting with you guys. So there's ways that you can chunk this into small steps. And the important thing is you do it regardless of your mood. And then you monitor and then keep building on it. These are kind of things a therapist would probably use. We left the link on here for psychology tools where you can download these. But if you want to do these with your kid, let's just pay attention. I'm going to do it too. Let's do it together. What are you doing most days? What feels good? What doesn't? And then put them into meaningful chunks. It's hard to come up with things you like to do when you're unmotivated. So try to find what they care about and put it into chunks, and then make an action plan for it. Again, this might be more complicated than you do as a parent, but I want to give you some of the tools you can use if it works for your family. It can be as simple as put it in the notes page of your phone, or put it in your calendar, or when do you want me to remind you? Tip number 3 is just take care of your health. If you're not taking care of your health, your mental health suffers. And keep this in mind throughout all of these. These are things to model to your child too. It's okay to not be okay. And it's okay to share that in small ways with them and show that you're doing this too. So get moving, go for a walk, walk your dog, run around in the backyard, put on some music, cook together, even get up and move and just kind of cook together. Try to make sure they're eating meals. Sometimes depression causes you to eat too much or not enough healthy choices. And set limits on the screens. This is a tricky one. If they're on it all day, then maybe we just pick an hour that they're off of it and need to be doing something else, or a half hour. And then you gradually build on that as you can make some progress. You meet them where they're at. Encourage a regular sleep schedule. They need 9 to 10 hours of sleep for their brain growth and to heal from depression and to have energy to do things the next day. Consider having no devices in bedrooms and making it a family plan so that it's easier for them to fall asleep. Give them some tips and tools. Get them out of bed during the day. If you're laying in bed all day or in bed all day after school, you're not going to be able to fall asleep as well. So these are all some tools that you can use to promote physical health. The theme of this is just be curious. Don't try to fix it. You've probably been there when you just want to talk about something and somebody jumps in and tries to fix it right away. As a parent, one of the best tools you can have so they will keep coming to you and asking for your support is just be compassionately curious, ask them questions, reflect back what they say. Listen without trying to fix it. You can validate the emotions without validating the unhealthy behaviors that go with it. And really try to use this time to focus on how you build your relationship and encourage them. Instead of saying things like, gosh, I really wish you were hanging out with friends more, and you know that's hard for them. Hey, I'm running to the grocery store. Why don't you jump on with me so that we can make sure we get the things for breakfast you like, and maybe on the way home we can swing by and get a Scooters or something. Try to find ways to encourage them to do things or figure out what they like to do and do it with them. And then ask where you can be helpful. Where can I help you? What can I do for you? And if they say nothing, go ahead and back off and keep asking. Try to be positive. This is hard because depression causes them to be sad and irritable, which can cause you to feel really overwhelming feelings as a parent. And so I like to ground myself before I speak. I push my feet into the floor. I take a little deep breath as a way to try to just be mindful of what must this moment be like for them and try to stay neutral or positive. Notice what they are doing. They might not be doing all the things they should be or all the things they could be, but what are they doing? If they're going to school every day and going to their classes and they're not doing their homework, let's validate that they're going and learn about how to use some of those accommodations that Dr. Brazil talked about so that we can build on chunking what they can do. Encourage them to notice what they're doing. Depression causes you to do a lot of shoulds, coulds, guilt tripping of yourself and others. Help them to start noticing that. And make sure you're as a parent, you're still going to have to provide corrective feedback a little bit. You're still going to have schedules for them. Just make sure you're balancing that with a lot of praise and encouragement for what they are doing and get them invested and well-rounded in some enjoyable activities, not just focusing on getting the schoolwork or the chores done. Even if you do all of these things, which is a lot, we start with 1, build into 2 and 3 and 4, just take it small. Even if you do all of them, problems might be bigger than you can tackle on your own as a family. And so look at these symptoms. And when you see these or a cluster of these, this is when you're going to need a professional team to work with you. And remember what we talked about with evidence-based treatments. That's your solution-focused therapy, the CBT, IPT, ACT, and DBT. And it's medication for severe or moderate depression, or if you have mild depression and treatment's not getting you where you need to be. Some families choose to do supportive talk therapy, and some kids get better from that. If you're doing any of these and they're not working for you, then try a different one, or have an honest conversation with your therapist about what you need out of therapy to maybe have more progress or consider adding medication. This part's really important. How do you support your teen through depression when they're in treatment with a therapist? You need to be involved, and they might not want you to be. They might want to just go in and privately do this on their own. They are going through that stage in life where they're ferociously independent and kind of separating from you. And that's a healthy part of development. And yet they still need you. And so what the research tells us is when parents are involved, outcomes improve. That doesn't mean you have to be in there the whole time directing it, but you have to figure out what your level of involvement is and do that with your child. Provide some choices for them on what you're involved in and what you're not. Really talk about limits to confidentiality with your treating provider, so that you know what they're going to tell you, so they know what you want them to tell you, and have your child involved in those conversations so they can trust your therapist and they can trust you. But what we know is that when you're involved as a parent, treatment can continue at home. And that's why these solution-focused treatments work, because you're not just doing it for an hour of therapy or 45 minutes of therapy. You're doing it every day, and you're making meaningful changes in your life so that you can handle adversity better and you can handle these hard things that have happened with your mood. It also shows the support of your child. They know to come to you. And it can address any challenges in your relationship that could help make both of your lives better. It also strengthens relapse, so you're less likely to have relapse if parents are involved in the treatment. And our final tip before we turn it over to Q&A is you. And you've heard it. And as a parent, I can tell you this is one of the hardest things, right? When you get on an airplane and they say, put your oxygen mask on before you put it on anyone traveling with you, it feels like no way. It goes against kind of your protective factors as a parent, but we know from lots and lots of research, if you're not acknowledging your own needs, your mental health needs, your physical needs, if you're not looking after your own health and using your resources, you're not going to be able to do what your kids need to be able to help them through these difficult situations. And so it's okay to be honest with them in an appropriate way. Like, oh, I had a hard day today and I'm feeling really overwhelmed today. So I need a half hour before we, get dinner ready for me to just go for a walk. Like, show them that you're human and you have hard days too, but you share it in a little tiny way and not all of the details. Be open and talk about it as a family. Don't have it be the white elephant in the room. That doesn't help the situation. And remember the siblings. This is hard for them too. Make sure that you're able to take care of yourself and them, even when you have a child who's really struggling. Do avoid the blame game, even if something happened. There's nothing, again, that's not modifiable, whatever has happened in the past. If we can build resiliency with protective factors, we're going to have better results. Don't take away all your routines. Routines help everybody in the family, but you might have to modify routines a little bit for your child with depression. And don't make depression all you talk about. Have fun together as a family. Set aside time where you talk about mood with your teenager, but don't take their emotional temperature all day. That doesn't help them feel better in the long run. Have set aside time when they know that you're going to talk. And then make sure that you're having fun together as a family. And then finally, we told you there'd be apps you can use. There's a whole host of apps on here that you can look into and explore. I like 3 good things. If the whole family's trying to focus on positive things, you just list them each day. Mood Path is a good tool to start tracking mood and giving yourself information. A lot of times you can learn from what is going well during the day and build on it. That's a really good way to start. Calm Harm app is very good if you have a child that has any self-harm or suicidal ideation. It has tools you can use for 5 or 15 minutes to get you through kind of that tough emotional feeling. MindShift is the first app I ever used, and it's a CBT app, and it gives you those CBT tools to work on at home as a family. And then I also like to provide a bunch of different ones. I know you're probably laughing like Teenagers Sesame Street. It's funny. And it's cute and it's fun. And I have teenagers who love using that. And it also is a good one that's developmentally appropriate for maybe other younger siblings, or if you have a child that has a developmental disability or a delay, they're really short, brief, little action things they can do to help with their mood, as well as stop, breathe, and think. That's one for teenagers, but also younger kids. And if you have a child who identifies as LGBTQ plus A, Trill Project is really a great resource for connecting with other people. And these have all been vetted by Common Sense Media, so they are safe for kids. And as a wrap up, we do have resources in our community. Call 988 if you need to. They will give you or your child, right in the moment, tips you can use to get out of a tough situation. Finding a provider these days is hard. I will be honest with you, there are wait lists everywhere. Behavioral Health Connections at UNMC can connect you to the right provider for you and your family in the community, not just at UNMC, it's in the whole community. They have a wealth of resources. And your best place to start is always your school counselor and your primary care physician. Most of our primary care offices for pediatrics do have a psychologist or behavioral health provider on site, and the middle schools do have behavioral health providers too. And your resources at school and with your primary care doc are a good place to start. And with that, Ashley and I are providing you some resources, and we're transitioning into the Q&A part.
Yes, thank you both so much. Such great information and helpful resources. We had a few questions submitted prior to the session today, so we can go ahead and start with those. And a reminder to our participants that if you have additional questions, please submit those through the Q&A pod at the bottom of your Zoom screen. So our first question submitted is, how do I support my teen if I'm suspecting something is bothering them, but every time I approach them about it, it seems to make them more upset?
Ashley, you want to take that one?
Yeah, I think this one is a really common scenario that a lot of families find themselves in, right? And this can be teens, adolescents with depression. It can just be normal part of adolescence, right? It's just, I'm having a rough day. Don't ask me about it. So I think there are a couple different strategies that I might suggest is, if you suspect something's bothering your teen, but every time you approach them, that just increases the irritability, they get upset, they may yell at you, outbursts, slam a door, things like that. When the teen is more calm, so after, don't push the matter in the moment. That's not going to do anything. It's going to get them escalated. It's going to probably escalate you too. And then we're just going to be in a cycle. When they're more calm, something you might try doing is say, hey, I really care about you. And sometimes I want to check in and see how you're doing. What would be the best way for me to do that? So getting their input. How would you like me to check in with you? Some teams will say, send me a text. I'd much rather you ask me over text, or I feel more comfortable texting it with you. Some teens may say, that's how I want to let you know that I need to talk. Or they may say, I just need a warning, right? They weren't expecting you to come in and have to dive into that. But don't push the matter. Something that you could do to try to engage them in an activity that they enjoy. Meet them on their level. Okay, if I know you like going to get scooters, which scooters is amazing, we know. Let's go get scooters. And while we're doing that, it opens up the door to just have normal chats. We're not even going to focus on the problem that, you notice there's a problem. Hey, what do you want to get at scooters? Oh, you really like this. I like this. It opens the doors to restart that communication. And you may not have a chance to address it in the moment, but it opens the doors to start that communication. Another thing that I think can just be helpful for a family unit is just developing a kind of structure or routine that works for your family to do family check-ins. So then it doesn't seem like off the cuff or just like sporadic, like whoa, why are you checking in now? This could happen during dinner time, or meal times. It could happen like once a week. We just sit around and check in. How are you doing? And I think you can share and I think it's important, not that you can, but you should share on a developmentally appropriate level, how you're doing. This week's been rough. I've had a lot of deadlines I didn't feel like I met, or I felt like I didn't do well at my job. It's been a rough week. I've struggled with that. You can keep it simple, but also model that labeling and that sharing.
Those are excellent, and that's where I would start as well. And at that family check-in time, I always like to share, like, some people call it your highs and your lows, but what went well this week? What do we want to celebrate? And I don't necessarily like to think about it as a low, but what was hard and how was I okay, or where can you help me with it? Is just modeling that we all have tough moments and we can get through them together. And oftentimes they're not as big as they seem in the moment. And when you have that kind of language as a family, it can help just start opening the doors. And the only other thing is, like, the first few times you're trying all these great ideas that Dr. Brazil came up with, they might give you a latitude and not want to talk. Just keep trying. Just keep trying and meet them at their terms when you're trying at first. Eventually, you're going to get somewhere.
I think those are such great tips. And I think it kind of gets back to, some of the things you were talking about in the presentation related to like that behavioral activation, and spending time together. And as you're spending that time together, that's when some of these conversations can kind of naturally play out. I love that. Another question that was submitted was, how do you know when children need support beyond what we can give them as parents?
I think it goes to what we talked about in the presentation a little bit about know when to seek professional help. Are they sad or irritable most days? Have they withdrawn from things that are really important to them, and not with a replacement kind of thing? Like, oh, I'm just got too much going on. I've got to prioritize this instead, and I'm going to put my energy. If it's a withdrawal and they're not replacing it or doing it with intention, not doing as well in school, the symptoms are persisting. You're trying some of those tips and tools. You're trying to connect with them. You're trying to get them more active, and the symptoms persist. Or you have significant fluctuations in weight or sleep or more risky behaviors, any of that suicidal ideation, or your child asks for help. If you're seeing any of those, then it's time to seek professional help.
Thank you. And I so appreciate all of the resources that were provided on the slides too. And I should have mentioned this in the beginning, but the slides will become available to all registrants for today. So you'll have access to all of the wonderful resources, the apps, the phone numbers that were provided today too. Our next question was, what are some good ways to connect with teens?
I think is you honestly are going to have to see what they're into. Like, I just like when you connect with others, right? When there's common ground of interest, you're gonna form connections, right? You're gonna have at least opportunities to form those connections. So I think identifying what your teens are into. If I have a teen that is into ice hockey and I could not care one thing about it, but a good way to connect with them might be going to an ice hockey game with them, right? Or watching it on TV or talking about their favorite teams. So I think finding something that they're interested in. Also think it's just showing up. So youth and adolescents need, even if they give you the tood, like Jenny said a couple times, right? Like, even if they act like they don't want you to show up and check in, do that, keep doing that. Don't stop that, because over time, you're at least, if you don't present the opportunity to connect, you're not going to connect, but at least you're opening the door, right? And you're letting them know that you're there and ready on their terms. And I also just think, coming up with fun ideas that you can go do together, right? And make it a routine. Like, this is a special, with one of my sons, we have a special mom son, like we go do this activity together, right? And I don't have teenagers yet, I have younger children, but we're setting the stage to be able to connect later on. So it becomes part of that routine of, hey, once a month, we're going to go do something special this morning. So I think coming up with ways to do that is really important, but I think getting on their level. Teens love TikTok right now. It's a thing, and I think just being willing to engage in topics and activities that are important to them is probably one of the biggest ways. And then being consistent to sum that all up. Even if you're not interested in those things, you have to reach out. You have to do those things.
Absolutely. My son kind of went through a phase where he was very interested in the video game Madden, which is a football video game. I have no interest in that. However, because it was something that he liked to do, I hopped onto that video game and tried to learn how to play it.
And it's
Um,
hard.
it is, yes.
I've been there.
I don't know what these plays are. I'm just going to click buttons and figure it out. Yes, absolutely. Another question submitted was, my child is being bullied at school, and I think it is really impacting their overall mood and is the cause of their depression. How do you handle a situation like this when you can't control the bullying as a parent?
This one is just one of the hardest things to do and go through as a parent, and to watch your child go through. The tricky thing about it is what we know about bullying is there often isn't anything that the victim of bullying can do to stop the bullying. It's really having procedures with the adults in their life and the school or the activities, and then the other kids, that the bullying behavior isn't tolerated and people are standing up to the bully. And so this is one you're not going to be able to figure out alone. You're going to have to use your resources. If this is a club or activity, or if it's happening at school, you need to talk to the adults and let them know what's happening. They may have some resources for you. There's ways that they can maybe monitor. Bullying doesn't happen as often when adults are around. So how do you get adults more around or work with your child to find places in the school or in the activity where they feel safe, who their safe people are, who they can go to during the day? I think that's super important. I think it's also important, again, I'm going to come back to how do we build protective factors and resiliency. And what are you doing as a family so your child's feeling connected and safe at home? You're going to have to take social media breaks and monitor social media usage, because a lot of the bullying is happening that way now, not at school. So figuring out who to friend and not friend, when to spend time on it, how much time, how to know when you're getting overwhelmed and to put it to the side and take a break is important. The other thing I think is important is finding them people they do connect with and feel good with, finding those positive peers in their life and having them be a source of support. Having at least one adult and at least one friend that are your people does build resiliency and is protective. The other thing that I'd encourage is it might be important to work with a mental health professional to build that resiliency. When people are saying these things or doing these things, how does your child feel good about themselves and know who they are and know what's good about them, even in the face of this unkindness? And making sure that they're building their confidence and building their mood and building their relationships with people who deserve to be their friends and be around them. It's probably not the answer you want to hear as a parent with bullying. We all want to just go take care of it. But you got to use your resources and focus on using some of those tools and tips throughout this presentation to build your child's emotional well-being and their toolkit.
One thing I do consider is, because like Dr. Burt said, is like, you at some point are going to have to be the advocate, right? Like you're going to have to probably work with schools. You're going to have to probably work with organizations where it's occurring. If it's on social media, there are certain things that you can just do. But I will say, just even validating and recognizing the challenge that this is for the child and the teen, right? It's difficult when you are persistently experiencing bullying. And a lot of times what I hear from teens is, no, do not talk to the school. It's going to make it worse. And from a parent's perspective, you're like, yes, I'm going to talk to the school, because you don't want to see that happening to them, right? So sometimes I just don't want you to be shocked if there's a mismatch, because sometimes the teen or child may not be ready in the action phase, like, I want to solve this, or no, I'm just fine, I'm going to let it go. But you see the impact it's having on them. So part of what I do is, you as a parent recognize there has to be a plan. Okay, something's got to change. And hopefully, like if they're seeing a therapist, hopefully they'd be able to work on this with your therapist. But I would include the teen in an action plan. So if they don't want you to go talk to the school, or they're nervous about you doing it, give them some control in that plan. okay, would you prefer to talk to I've got to talk to the school. Would you prefer to do it with me or me do it alone? Would you prefer I go in the morning? Would you prefer I go in the afternoon during school hour? So like things that they can have some choice in, giving them some choice and empowering them in developing this plan or whatever your plan of action is, I think is just really important to you.
Absolutely. I think those are such great tips. And I am looking at the time and I want to, we'll skip to have one more question. So a question submitted was, does childhood depression often continue into adulthood?
Yes, it can is the question. It depends. If it's left untreated, or if it's in, moderate severe, it depends when it onsets. There's so many different factors. But I think one of the biggest things that you can do to help protect from that, is getting treatment. And I would like to say, like, depression is not just like an illness that we, get treatment for, and a lot of it just goes away forever. Sometimes you can notice recurrent episodes. So just because you had depression for a little bit, you got treatment, medication, it got better, you noticed a relief in symptoms, doesn't mean that it can't come back one day. Some kind of environmental stressor triggers. Remember, it's biologically based, but it can be triggered by environmental stressors. So it's not uncommon to notice these ebbs and flows in these symptoms. So it's the question. I know that's not the answer you want, like a persistent, but it depends. It's very individual based. Dr. Barrett, would you add anything to that?
No, I agree 100%. And I think the important piece, because, we also want to build hope. If you've overcome depression before, you have the tools to overcome it again. And oftentimes the treatment isn't necessarily as long as it is the first time, because you can tap back into those things that worked for you and then apply them to your life now and your situation now. And that might be some things you start with on your own at first, that behavioral activation, that connecting with others, feeling successful. And then if that isn't working for you, then using your resources and the mental health community to help you.
Thank you both so much. Such great information today. Really wonderful tips for parents in our community. And we thank you so much for your time today. And thank you to our presenters.
Thank you.
Thank you.